Consultant psychiatrist Dr. Elena Maritan is an expert on OCD, which affects an estimated 1 million people in the UK.
OCD is made up of two different symptoms, the obsessions and the compulsions. The obsessions are repetitive thoughts that usually the person finds very disturbing. They can be around many different things. Worrying about hygiene, the worry of harming someone or harming themselves, even if they don't have any intention of harming anyone. And then there are the compulsions. The compulsions are not always there. But most of the time people develop the compulsion as a way to try and control the obsession. So if someone is very preoccupied around hygiene, they can spend even more than 20 minutes washing their hands.
This all sounds very familiar, and Dr. Maritan will be assessing me later to see if it's likely I have OCD. Sean Flores from London found himself obsessing over thoughts that he was gay, despite in reality being straight.
From the minute I slept to the minute I woke up, I was always obsessing, trying to find evidence, trying to prove that I was somehow gay.
He also developed an obsessive fear of harming himself or people close to him.
I remember I called Samaritans 3 nights in a row as a result of this, the OCD thoughts. It was terrible, and it was just my brain on a hamster wheel. I became a recluse for a very long time. I was terrified to be outside, I was terrified to be triggered.
With help from a therapist, Sean is now managing his OCD symptoms and has become an advocate for people with the disorder.
I think my life has never been the same since OCD, in some good ways, in some bad ways. I'm a lot more grateful for life. It's still tough to some degree, but there's a renewed sense of purpose.
Dr. Maritan has agreed to assess me.
I'm going to ask you some specific questions around OCD, but also about your mental health in general.
I tell her that I spend around an hour cleaning myself and my belongings every time I come home, and that I have to do a round of checks several times every night.
I think it's just that feeling of it being with you all day, and it's everywhere and it's all the time, and I think that's what I'm going to get upset. That's what I'm struggling with, is because it just feels like it's taking over a bit.
Because you feel that it's affecting you more now.
Yeah, I just don't want to get to that point where it becomes too much.
It is hard to talk about, but I'm worried if I don't address this issue now, it could get worse. After an hour and a half, Dr. Maritan has reached a conclusion and tells me off camera that I do have a mild form of OCD.
You spend more than an hour every day, both cleaning up and checking things. Yeah. You still manage to function quite well because you're working every day, you have a social life, but the symptoms are having an impact on your everyday life.
Do you know what? I weirdly feel sort of relieved that you have said it's OCD. It just makes me feel like all this stuff is happening for a reason.
And now I know what the problem is, I can find a way to get past it.
So there are two main treatments for OCD, psychotherapy and medications. In your case, I would start with psychotherapy because you're still functioning quite well.
Yeah.
So, and this is a good time to start and intervene on the symptoms.
This has been a tough journey for me, but I'm so glad I have a better understanding of what I've been struggling with, and hopefully I can now find a way to navigate it. If you suspect you have OCD, the NHS recommends you speak to your GP.
There are treatments available, but I do think that the stigma around mental health conditions needs to be lifted, and in particular, we need to take OCD a lot more seriously.